Okay, guys, it's Christina Blackfeather here, and I messed up something moving the camera from one computer to the other. So I'm only going to have audio from this video that I'm commenting on, which is probably better anyway. Um, I am going to do a response today. The Geek Room brought up Patriot Nurse, and I haven't looked at her for some time. And the reason why I have not looked at her is because I find her absolutely insulting to the profession of nursing. Now, there are questions regarding does she actually have a valid license to practice? Does she not? They have her real name, and they have not been able to find any information on her as far as actually having a valid license. She does have a Bachelor of Science in Nursing, but it is the school side of it. She isn't registered with the Board of Nursing. She's not registered with a nurse midwife registry in Tennessee or North Carolina. And I believe in both states she has to have a valid RN to be or the valid RN would come through the nurse midwife registry, and she is not listed there either. But she would require that BSN. And yes, there's kittens. So they're not able to find her actual credentials on this. But that said, she has quite the following. She has been on Netflix, what is it? Their Doomsday Preppers show, as she's been one of the experts that has appeared randomly on prepping. So I have to admit, some of her advice is actually pretty good. Especially if you're falling on any sort of hard times, to be able to prep ahead of time in case you're going to have hard times. The way this world is right now, we just don't know. Our economy in the United States is terrible, especially if you're middle class. One bad life event can set you into poverty very quickly. So prepping for some of this I can understand. As far as she'll have, like if you do have power out for 4 or 5 days, which has happened to me personally in 2 different locations. What water filtration things to get, because sometimes, like if you're on well water or if you're on a community water system and something were to happen, like with where we live, the Mississippi River will sometimes back up into the water supply. It has happened in a place I used to live as well, where the water was brown and smelled like swamp for like several days. So yeah, all this stuff, she mixes the things that make sense with the woo, and it is kind of dangerous woo. The video I'm going through here is about her, she's calling it polio spreading herd immunity and blaming the anti-vaxxers. Now, I am very pro-vaccination, and as many of you know, and if you have my Facebook, it's easy to look me up on the Board of Nursing. Thank you. I work in pediatrics specifically. I've done critical care in-home, so people on vents, in-home dialysis, all of that stuff since 1997. I have also worked in dialysis specifically for 6 years, both acute dialysis in the hospitals and clinic dialysis, and have performed in-home dialysis, and I've also had some psychiatric background as well. So I've been around the block too, but specifically now, this whole time I had taken care of kids off and on over the years, and now I am tightly focused on taking care of children and infants. And some of it's because of my own health reasons, and now I'm not allowed to lift over 30 pounds because of my surgery last October. So you have my background. I am pro-vax. I am still pro-abortion, even though I think abortion is used too much. It shouldn't be a method of birth control. We should have other things in place that are freely accessible and easy to get to, and have laws in place that allow for it, because there isn't going to be a way to prevent teenagers from doing things. We should make, birth control and condoms, and even if it's injectables when they're 18, and to have that stuff free, because I think that would save a lot on our economy and stuff in the long run. And then better health education, better sex education, not educating abstinence only, to actually have real health education, how the human body works, how pregnancy works, what things to watch out for, preventative education, and just overall nutrition and everything else education besides, so the person has a better chance of not having a child until they want one, if they do. And this is going to actually slow down the abortion rate immensely if we take these measures into effect, and all of that being provided free, mind you. That would save our economy a lot in the long run. So those are my stances. Now we're going to get on to her.
What's the deal with herd immunity, and can we expect more diseases like this to show up, diseases that there is no vaccine for? What do we do about this? So the first thing, acute flaccid myelitis. This is not a polio disease specifically. However, the way that it presents is kind of similar to polio.
Okay, let's go take a look at acute flaccid myelitis really quick here. There it is. Rare but serious conditions follow a viral. It sometimes follows a viral illness and can include sudden muscle weakness in arms and legs, neck weakness. Let's see, here we go. This is from the Minnesota Department of Health. And other symptoms that patients may have include drooping eyelids or facial droop, difficulty swallowing, or slurred speech. So this too, some of these symptoms also can be in a stroke. So they say contact your healthcare provider as soon as possible if you notice any of these symptoms in your child. If you see them in an adult, definitely calling 911. I'm just putting that out there. Or if they're not using their arm or leg normally. Wash hands frequently to limit exposure to germs, cover coughs or sneezes, stay home when sick, make sure you and your family are up to date on vaccinations, and take steps to prevent mosquito bites, because they can spread by mosquito bite. Let's see, what else have we got? They're all saying it's rare. Now let's take a look at polio, shall we? Now, it did show polio-like virus, so that's what she's talking about. Poliomyelitis is a crippling and potentially deadly infectious disease. It's caused by the polio virus, which spreads from person to person and can invade an infected person's brain and spinal cord, causing paralysis. Most people who get infected with polio virus, about 72 out of 100, will not have any visible symptoms. That's still a high rate of people who would show symptoms. About 1 out of every 4 with polio virus infection will have flu-like symptoms that may include sore throat, fever, tiredness, nausea, headache, and stomach pain. They last 2 to 5 days and go away. A smaller proportion of people with polio virus infection will develop more serious symptoms that affect the brain and spinal cord. Paresthesia, which is feelings of pins and needles in the legs. Meningitis, which is infection of the covering of the spinal cord and or brain, and occurs in about 1 of 25 people with polio virus infection. Paralysis, can't move parts of the body, or weakness in arms, legs, or both, occurs about in 1 out of 200 people with polio virus infection. So already we have caught this woman in a lie. She is stating that these two things, that the one, even though it has polio-like symptoms, there are vast differences between the two. And she is deliberately conflating the two to confuse people. This is in part, I'm saying deliberately, because she's selling stuff and she holds clinics and everything else and gets paid a lot of money.
In the sense that when people think about polio, they think about progressive paralysis, that a person will stop being able to move a certain part of their body, and then that lack of mobility starts to spread. And
that is not the case. I have cared for patients who had been paralyzed because of polio, and it doesn't just go, oh, we're going to start here and we're going to start there. It'll do the pins and needles and stuff, but the paralysis itself is going to come on fairly suddenly.
And that's kind of similar to what acute flaccid myelitis is. And this is not something that is spreading like a pandemic. This is not, to our knowledge right now, contagious.
Oh, that one set me off. We know this is contagious. The reason why it is not an epidemic right now is because we've been vaccinating against it. We've almost completely eliminated it up until this new wave of anti-vaxxers and people coming in from countries that they have not had the vaccinations, which is why a lot of them are being required to be vaccinated before they can enter the States. There is a reason for this, because it's going to save lives and it's going to save suffering. But just you wait. I haven't watched this whole thing because I got so livid I had to stop.
From the data that I've seen, at least, and your risk level is about 1 in a million kids. So basically, your kid has a much greater likelihood of getting seriously injured with a bicycle accident.
Okay, that's a current risk value. If we continue with this anti-vaccination stuff, this risk value is going to go up a lot higher and very quickly. Considering how many children are being born, and this woman is working as a midwife in a birthing center. So what is she advising new parents? Yeah. So we're going to increase the risk factor. It's low right now because we have vaccines.
Than getting this, okay? So just perspective. But it scares people. It scares people because it looks like polio. It walks like the duck. It kind of quacks like the duck. We're not sure if it's a duck.
We've already shown that it does not.
It may be something else. But for a lot of people that are reading this in the news, it's very scary. And there's a tendency, and I've already seen this in the news, to turn around and completely and baselessly blame parents who either delay or choose to selectively or not vaccinate their children for that. And that is absolutely baseless and false.
No, it is not. That is exactly what's going on. And that is exactly one of the most major problems that's happening with this. In Minnesota alone, just this last spring, we had an exposure of measles to certain schools, and there was a large exposure, and one of my former patients that I know personally that is on immune suppressants had been exposed. And so they had to watch, because she would have had to go to the hospital immediately. And had she gotten exposed, she'd have died. This is very serious, you guys.
So primarily here we should focus on one thing, that acute flaccid myelitis is not the same as paralytic polio myelitis. Okay, like polio is not the same thing as what's going on here.
Thank you. She actually said something that's true.
And I think it's worth noting also that a lot of these people who are trying to scare the living daylights out of individuals regarding, vaccines, and you must get your children vaccinated with whatever the latest and greatest CDC overkill recommendation is with their schedule.
The reason why the CDC is doing a lot of these together, first off, that schedule is not going to hurt your child unless they're having an allergic reaction, which is something that cannot be predicted, really. But the reason they have actually done this, devised this schedule to make the best prevention possible against some very, very serious illnesses that can kill your child. The schedule is not as too much as people like to say. And I don't remember the numbers exactly, but at this point, I think there's actually fewer vaccine formulas that are being injected separately now than there were before. So it is right now safer for your children than it was, say, 20, 30 years ago to get vaccinated, even with this horrible schedule that they're doing. It's working, and it's very clearly working. Now, occasionally, as I said, some kids will have a very bad allergic response. Those are very rare cases, and you can't predict it any more than you can predict somebody's going to suddenly be allergic to bees for the first time, or they have shellfish for the first time and respond to that. Should we make bees and shellfish illegal? I mean, seriously, this is how stupid this is.
What they are doing is they're setting people up to profit off of them. Vaccines make people a lot of money. Vaccines are one of the few areas, especially in pediatric medicine, where money is made, primarily because a lot of these clinics, a lot of these doctors' offices, especially in areas that are underserved, they get these vaccines for free, and then from the government, meaning us, the taxpayers, and then they're able to charge people for it. And
no. They charge the insurances for it, and there's not a lot of money involved anyway. There's only a few dollars per vaccine. If a person does not have any income and can't get insurance, they will allow this person to get vaccinated for free, to have their child vaccinated for free. What this is a person who is very privileged, who is talking about what it's like, what is done to people who are poor. And that is not the case. Where money is being made more often than not with pediatrics is with the adjunct care, with Lamaze, with these fancy things, with these amber teething necklaces that people sell that are actually dangerous for kids, by the way. Stuff, the woo and all of this stuff that they're trying to promote besides. And so the money is not being made on vaccines, and especially if it is preventing in the long run. And people have heard me say this before, and I will say it again. The money actually comes from treating the illness. It does not come from prevention. You're making more money if you have somebody that is diabetic and ends up with renal failure going in for treatment, because that's now I think probably $5,000 or $6,000 a week for 3 dialysis treatments a week. While they could have prevented it with diet and exercise and appropriate medications, now we're dealing with the treatment part, and that is where the money is made. Between what they bill for gauze, what they bill for Tylenol, all of that stuff. She is lying. She is absolutely blatantly lying to push her agenda.
it's one of the few things in certain practices that allow practices to be in the black. And so it's for that reason they're pushed, not necessarily because it's best for the patient per se.
Oh, lies, lies, lies. Tell me lies, tell me sweet little lies.
But one of the things that I've been reading over the past few days that kind of troubled me is, again, this idea that somehow this disease that is A, not contagious to our knowledge, B, extremely
lies,
rare, less than 1 in a million chance, and then C, like less than
bending the truth,
300 cases over the past 5 years.
Bending the truth.
That this is somehow related to parents, choosing to delay vaccines, to spread them out, to not vaccinate or selectively vaccinate.
Truth.
And again, that's just not true. I keep hearing, and I've also heard again from government officials, that it's your duty, it's your civic duty to get your flu vaccine, or it's your civic duty to do this. Well, let's back the truck up here. Anything that I do to my body is therefore my choice. If you're going to claim and use the stance that abortion is a woman's right because it's her body or her choice, are you somehow going to say that it's her civic duty to decide whether or not to have an abortion? No, absolutely not, because it's the individual's body. So
now, I'm of mixed views on this one, because Yeah, she has a valid point with this. If but abortion is not comparable to vaccinating and protecting your fellow humans. It is a civic duty. A civic duty is not um, oh, mandatory. It should be, like voting, but it isn't. You can refuse to vote. You can refuse to vaccinate. The only thing with vaccination, just like with voting, you can't complain if somebody you didn't want got into office. With vaccination, you cannot complain if your child's not allowed in school because they're not vaccinated. Sorry, there are consequences to it, and they're valid consequences, and there's reasons, because you get these children into school where you have, and I have to admit, it's kind of a cesspit of infection. Kids bring home stuff all the time, kids get stuff all the time. That's why you want them vaccinated. And guess what? It happens in daycares, it happens in private schools, and it happens in public schools. It happens in the mall. You come home and your kid is sick, and then you get sick, and on and on and on like that. That's how this stuff spreads. Having them in private school or a non-vaccinated only school is not going to help, because all it's going to take is one child to bring it in. That's why in schools too, if your child's preventing with a fever, they cannot come back to the school until that fever has been resolved for over 24 hours. Because that means that they're going to have less chance of spreading that illness to other children. But still, you want to be able to vaccinate in order to help not only protect other kids, but this does help protect your child as well. The vaccine will decrease the chances that your child is going to get something. There still will be a chance there, but it's going to drastically decrease it, because it's increasing your child's own immunity, and teaching their body that they have to be ready in case they're ever exposed to this virus. And that's what it is. It's training the body. It's training the immune system to recognize this thing. So if they do get future exposure, that it is something that their body is going to be able to fight off.
So if you're going to continue that line of logic, then it is not some sort of civic duty to have a medical procedure done, or to take a drug, or to do something to yourself. It is an individual's right and choice to be able to choose what they want to. And so oftentimes...
But you also have to realize what the consequences are and deal with the consequences. And in this case, the consequences of not vaccinating can be very fatal for your child, or fatal for somebody else's child.
You know, you're hearing this argument that, oh, it's for the people who can't, they're too young to be vaccinated. Oh, it's for them.
Here it comes.
You know, the young children. Okay, while I do understand the plight of parents who have had to watch their children suffer in early childhood, you chose to have sex to bring that child into this world.
So it's the parents' fault. This, I think I made it a few more minutes before I lost it watching this. This is why I have kittens. Because she just set me off. We're blaming the parents for having a child at this point. Even if it is something that they planned to have the child and then didn't expect what is wrong with the child once it's born. But yet, she is against abortion too. And I find this absolutely appalling. This just made me want to throw my phone across the room. To have somebody who is anti-abortion, who is also anti-life and anti-children and anti-health. And she claims she's a nurse. Okay, I'm done ranting. I promise.
Okay, let's clarify here. Because it's not my decision to bring that child into this world. You did. And when you have sex and you realize that I can get pregnant in doing this, I am assuming all of the risk. I am assuming all of the risk for pain at losing that child, God forbid. I'm assuming all of that risk in being able to have fun and have sex and bring a child into the world and maybe have them, God forbid, suffer a horrible illness and die. But again, I didn't choose that for you. You did.
So her reasoning to this is that at that point she shouldn't have to take any sort of action with her children to prevent your child from getting sick. Because you chose to have a child and it's your fault. I can't. I can't. I'm 4 minutes into this video. And this is my second time getting to this exact part. And I'm angry again. This is my live reaction, guys. I am so angry right now. Because this woman is anti-abortion. Yet she believes in the Bible and she thinks that you have to abide by biblical law, which includes having children. So what does she expect people to do? And yet we don't have birth control being free. We don't have proper health education. We don't have these things in line to make it so that there are less abortions, again, as I said previously in this video. But yet she's going to go blame that parent for having a child who is sick. What she does not realize is the more unvaccinated children there are, and we're already seeing it, the more the disease is going to spread, and the more it will eventually spread to children who are vaccinated. And it does not matter if the parent chose to have sex or chose to have that child or not. The fact is that child is there. And at this point, this woman is pro-life up until that child has been born. And after that, all bets are off. She doesn't give a rat's patoot. She doesn't care about your child's health, anything. And she claims she's a nurse, and I find that utterly, horribly insulting. And if she has a license, I'm sorry, it should be pulled. I mean, she's terrible. This woman is a liar. And then she's quoting the Bible in another video too, where she's saying that they're using living fetal tissue from current abortions, yet that fetal tissue is from the 1960s, from strains that they have been keeping the cells reproducing and alive to do testing. It's not even current stuff. But this is all the lies and manipulations that this woman is making up to make sure that people do not vaccinate, and that they become afraid to vaccinate and become afraid of the medical system and afraid of proper medical care for their children. She is a fearmonger. She is insulting to the nursing profession, and she claims to follow Florence Nightingale's oath that she took. Lies. Utter crap lies. And that's all I can stand right now. I'm done. I will try to get to this later, but I'm too livid. So I'm going to enjoy the fluff. Hopefully you guys will enjoy the fluff too. I'll try to tackle this another day with the rest of this video, but again, twice, and I can't get past this point. All right, talk to you later. Blessed be everybody.